that we have explored team membership responsibilities, styles, and strategies, we'll now turn to specific strategies and tools essential for both leaders and members. The strategies and tools relate to the 5 core principles of collaboration discussed earlier in the module, particularly effective communication and trust, and they are situational awareness, inquiry and advocacy, and giving and receiving feedback. So why these particular tools? They're essential for collaboration, they're practical, and one can use them immediately regardless of whether a leader or a member, which is relevant particularly to students earlier in their training for whom these modules are intended. So let's begin our discussion of the first tool, situational awareness, by returning to the story of Elaine Bromley.
There was a question mark in the inquest about who people felt was in charge at different points. There was certainly a loss of awareness, an awareness of time, but also an awareness of the seriousness of the situation. If you like, the awareness of what was happening wasn't shared by each of the consultants. There was certainly a breakdown in the decision-making processes, and it would appear that the communication processes dried up amongst the consultants.
This video excerpt highlights the need to be aware of and responsive to the situation, which is called situational awareness. It's a very important strategy for maximizing team effectiveness and patient safety, and is defined as a monitoring of the internal and external environment of the team, managing resources effectively, and adjusting the plan as necessary. It's a responsiveness to continually evolving conditions. In particular, it's an awareness and responsiveness to the ordinary elements of a situation, particular or extraordinary elements, implications of these elements, possible outcomes of the situation, and best responses to these outcomes. It seems like a lot to keep track of, but situational awareness is a dynamic process that we do all the time, like when driving a car. In order to keep the car on the road and avoid an accident, a driver must continually monitor traffic and other drivers, road conditions, effects of weather, and pay attention to these all at once while driving. In order to optimize situational awareness, we must practice doing it. It is a product of training, practice, experience, and expertise. We must also be aware of the many factors that affect situational awareness. There are many instances when situational awareness declines due to unclear expectations or biases, poor quality of communication, inexperience, too much or too little data, fatigue, stress, and distraction, and an unbalanced focus. All these factors can adversely affect situational awareness and the response time needed to correct or align the situation. The ability to stay focused is vital to team member effectiveness. If we have situational awareness and are thus aware and responsive, we can change the course or abandon the original plan in response to emergent conditions that demand different actions. So in summary, situational awareness is a responsibility of both team leaders and members. It's the ability to maintain an awareness of the big picture, regardless of crises or distractions, and to respond in a timely manner. It's important to recognize and reduce factors that diminish situational awareness when possible. So for this forum discussion question, can you think of an example, either in or out of a healthcare setting, where situational awareness was lost? And what were the consequences of that?